Good morning, welcome. I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Max Garut. Dr. Garut is a cardiologist. If you have any questions for Dr. Garut in the future, any of my other guests, two ways to reach me. You can reach me on my web. It's www.needfoundation.org or fax 696-9012. I'd like to talk about veterans health care. The battle at home. Veterans are encountering administrative barriers, waiting lists, and staffing shortages when they're trying to use the VA's health system. Well, that's not very much news for us physicians that basically went through these training programs at the VA. The VA is, if you ever want to see socialized medicine in the United States, go to the VA. It is a fixed cost system. It's an extremely frustrating system when I was over there. Let me give you a story. Every week I'd go to Total Joint Clinic and sign up 12 guys for total joints. I was able to do one a week, so I had a list, card catalog that big. Now I figured out how to do 2 a week, because what they used to do is we'd do the surgery, crutch train them, they'd order the crutches, 3 days later the crutches would come in, the guy would be discharged. Now I could bring another person in. So I said, I'm going to crutch train them the night they came in, order the crutches. Guess what? I cut the admission down to half, and I was able to do 2 total joints a week. I got called down to the administrator's office and was told to stop doing this. Bottom line was, he said something about safety, but it wasn't. I was costing the system. See, they got paid per diem. If the bed's full and nothing gets done, they get a certain amount of income. It's a fixed cost. If I'm in there doing 3, 4, 5 total joints, they've got to pay the implant manufacturer, and it comes out of their budget. Fixed cost system, all right? Now, in my opinion, a lot of things get done at the system simply because you have a lot of training physicians like I was, wanting to get procedures done. So here are the veterans coming back, and they have physicians who are not board certified like myself training, which is okay because they're under supervision. But the only reason things got done, in my opinion, is because you had docs like me wanting to get procedures done against a headwind of a bureaucracy and inefficiency not wanting us to get things done. For example, one of the rules was if you couldn't finish a case by 3 or guarantee you could finish a case by 3, they wouldn't let you start it. And it was the opinion of the OR nurse at that time if you could finish it or not. For example, if you had a total knee where you hadn't made the skin incision by noon, they wouldn't let you start that knee because they'd be afraid you wouldn't be done by 3. That's when shift change occurs. And God forbid they'd have to have people stay over. So basically they used an excuse not to get it done. And nobody from the bureaucracy above would ever change that. Why should they want to? It wouldn't get done that way. Again, they saved money. The clinics, huge clinics. Here all these guys come in. We used to have anybody that just wanted refills, because we'd have 160 in a clinic. Anyone with refills for back pain, come up forward, stand up, bend forward, touch your toes. Up, somebody said something, go sit down. That's the only way we could get these guys out. So we'd do 12, 14, 15 refills for back pain, and then start seeing some of the others in the general clinic. So basically what you're looking at in this system is a fixed amount of money that's budgeted. And Medicare recipients get used to this. It's going to happen next, because that's next socialized system. So you have a socialized fixed system that can't spend more than what they're allotted. And the bureaucracy is there to make sure that doesn't happen. You know what? I think this is wrong. Our soldiers, if anybody, deserve the best care, not the worst care. In my opinion, every soldier should be turned over to private health care industry, not put through the system. The argument is it would be too expensive. My answer to that is, yeah, but it would be expense at doing health care, not supporting a bureaucracy to stop the health care. These are my opinions. If you have any comments, 2 ways to reach me. On the web at www.needfoundation.org or fax 696-9012 to ask the doctor.